Welcome to the Passion for Patients podcast. I'm Tonya Winders, your host, and the president and CEO of GAAPP. We are a global organization that is dedicated to the mission of helping people live better and breathe better. I am so excited to welcome back our guest to the podcast today, Victor Gascon Morino, the Vice President of Awareness and Operations. Welcome, Victor.
Hi, Tonya. Happy to be back.
Excited to have you back.
Yes, here in beautiful Nashville.
Thanks. Yeah, no, it's been great to film here and to have some time together. But I am so excited about this topic today because it is one that is a hot topic and a lot of people have asked us questions about. Artificial intelligence. What is it? How is it used in healthcare advocacy?
First of all, AI is one of my passions, so I'm very happy to solve any questions surrounding the topic. So AI is artificial intelligence is a computer system that is able to, is designed to process tasks that normally requires a human intelligence, right? Like understanding languages, recognizing patterns, and making decisions. So how do we apply this for healthcare, right? Or for health advocacy? So one way that we use AI in health advocacy is taking advantage of that resource to provide like personalized education, giving access to materials that the patients probably didn't see otherwise. It's great for monitoring, predicting health risk, predicting exacerbations, right? But always in an educational way, right? Never replacing a doctor, which is something that we will talk
so
afterwards.
That's totally right there, because here's the thing. All the buzz about artificial intelligence, AI, I actually call it augmented intelligence. Augmented meaning it's only as good as the people behind it and the interpretation and the way we're using that information or data. So it's not completely like a robot, artificial intelligence, machine learning off to the side without any human interaction. So that's why I like to use AI as augmented intelligence instead of artificial intelligence. What do you think about that?
No, definitely. I think we should perceive, like, if we have to have like a mental picture of AI, we should not picture Terminator, right?
Yes.
Like, or like a robot, but
it's going to eliminate all
your
people.
Yeah, exactly.
Machines.
No, you should picture as something that is in the background supporting the healthcare professional and the healthcare team to make like better informed decisions, faster decisions, and decisions based in more evidence that otherwise we will not have by traditional channels. So you still need to picture your doctor in front of you, not a robot.
Yes, I definitely don't want to be treated solely by a robot or treated as a robot, right? I want that personal human connection and interaction in healthcare especially. So let's talk about big data and especially like pharma research, right? Huge resource with so many data points. How might we take that information, apply artificial intelligence, and then leverage it for our patient advocacy work?
So AI is something that we can use at a very high cost and a lower cost, right? So with the way the pharma, for example, use AI, the economic investment in getting AI systems is much bigger, but then it's so cost effective, right? Because AI has managed to reduce drug development pipeline sometimes by 6 or 12 months. And then when we talk about treatment development that takes 10 years, reducing almost a year out of it,
that's huge, right? That
huge.
Is saving lives by getting new treatments in the hands of patients who need them at least 6 to 12 months, if not more, earlier.
Yeah, and that reduces costs as well in the long term, right? So while the investment is big, then there is very cost effective in the long term. So when we come to like smaller, right, like quote unquote smaller use in health advocacy, it is the same. At the beginning, we will have some investment to do in acquiring and implementing that technology in whatever project we have. But then the cost effectiveness, it will be reflected in the future, right? In a 1 year or 6 months running of the project, because the scalability of whatever you do with AI, it's infinite. And you should always look for support, right? Like you should not bear those costs by yourself. Like look for a sponsor or something. They will always be open to have this kind of innovative and novel projects.
Yeah, we've just recently launched a little project with the support of some industry support on doing an asthma chat bot, right, on our website at GAAPP.org, as well as on Asthma Canada, one of our member organizations. And I think these are the kind of like tiptoeing into the world of artificial intelligence, the way it could be used for patient advocacy that will get us more comfortable as a community with this new technology and new learnings from the technology.
Definitely. And always picture monitoring and support, right? Never picture like replacing anyone. That's always something very important that I think that is stopping some organizations from using AI because of misunderstanding.
That makes me think of my next question, right? Because there are a lot of myths out there about AI and is it going to completely replace people? Am I going to lose my job because a computer can now do it? Or what are some of the myths that you think are out there and how do we address those myths?
Well, first, I don't think you will lose your job, Tonya. So you're okay.
There may be a GAAPP president, AI
president. I don't think that can happen in the next 100 years. But so I'm going to give you 3 myth busting time now. So the first myth, AI will never replace a doctor. AI serves as a tool to assist healthcare professionals to analyze those vast amount of data quickly and providing insights that other ways the doctor or the health center will not be able to get, right? So it's an enhancement and a streamlining of their work, but they will never be replaced, right? So that the doctor will still be there. It would just be there with better information and being able to make a more informed decision. So second myth is like that is infallible, right? Because it's technology. It is definitely not infallible.
It is not perfect.
It is not perfect because AI is as good as the amount of data that you feed into it, like the data mining. And
what do we say? Garbage in, garbage out. So definitely if you're not feeding the right data and getting good data up front, the outcome of the AI or clinical decision support tool is not going to be as pristine either. Right?
Exactly. And we're going to talk about AI bias in the next questions, but is it as good as the information that you feed it? And the amount of information that you have to feed it AI is just huge for it to be, because every person is so different, right? Everybody, every condition. So we need to make sure that AI has as much information about all of us to make sure that they can do like good prediction models and
yes,
and information.
The more data we have, the more information we have, the better the models get at predicting the actual outcome, right?
Exactly.
So what's another myth?
So the last myth is like it will increase the healthcare cost, right? Like, oh, this is a new technology, it's costly, it's just going to be reflected on my insurance bill, on my taxes. Actually, the cost of implementing any new technology is always high, especially when it's novel, quote, somehow novel technology like AI, even though it has been around 10 years, we still consider it groundbreaking technology. The cost of implementing is going to be slightly high, but then again, in the long run, all that money that we will save by reducing error, reducing wrong diagnosis, just because the healthcare team didn't have all the information that they needed, enabling personalized medicine and being able to work from one size fits all treatment to like a personalized treatment. At the end, it all will reduce costs at the end of the line.
Yeah, it brings up such a great point because I've said so many times, the aim of advocacy is to get the right treatment to the right patient at the right time with the fewest barriers, right? So if we can have artificial intelligence or augmented intelligence that helps us to get there sooner and to lower that risk of medication errors or misdiagnosis, like that is, again, money in the bank for the healthcare system and money in the bank for us as passionate patient advocates.
Yes.
Yeah. So we've talked about some of the myths. Now let's talk about some of the challenges with AI.
The biggest challenges with AI is the same challenge that we would have with any new technology that we bring or it has been developed in the West, right? So AI is a very novel technology. And while in Europe, in the US and Canada, like the Western countries, we have now a legal framework for AI to operate. And we have all these data protection laws, GDPR, HIPAA. So there is a clear framework on how to operate and implement AI. some of the countries and low middle income countries still haven't catch up to that, right? So together with like difficult socio-demographics or geographical challenges make it very difficult to actually data mine from low middle income countries, right? So one of the flaws that our system, the AI has nowadays is that it has been fed information only from Western countries.
Yes.
In a sense.
Yeah, I think that's a valid criticism, right? Because most of the data that has been input into large data sets, into artificial intelligence, have come from either Europe or the Americas. And so I think that it's time now, as we explore and advance, that we make sure we balance that perspective from Africa, Asia Pacific, definitely low to middle income countries rather than developed.
Yeah, so that was my last point on this question, is like that's why it's so important that we support AI projects in all those regions, because we really need to be feeding, data mining and feeding to AI information from all these other people, right, that we don't have in the picture now. I think one example that is not health related, but I think everyone will know this example is like the machines in the immigration in the airport.
Yes.
Sometimes they don't recognize certain ethnicities, depends on the country, just because they haven't fed information from that ethnicity to that country. So it's like they will not recognize your face.
Right.
An example that is applied to health, like we have been developing using for dermatology, right? Like AI to recognize possible risk or recognize possible
right, to show a reaction to say, is it eczema, is it hives, is it chronic urticaria? Yeah.
So we haven't fed enough information about darker skin tones or different ethnicities into the system. So sometimes we will have challenge where, for example, Black people's skins will not be as recognized or So that's why the AI, in a sense, is biased, because we haven't fed all the information that we have, and that's our challenge.
I think that's a legitimate challenge, right? It's fair that, as we said before, until we get enough good information on the front end, the back end is not going to have the type of outcome and solution that really is refined enough. So it's incumbent on us as patient advocates, I think, to support these kind of projects, to get more data that's more representative of the full scope of patients across the world.
Exactly. So challenge accepted and...
Challenge accepted. We're ready to do it. Any other challenges you want to share?
So the other challenge, obviously, when it comes to implementing AI also in low middle income countries, again, is that initial cost is going to be always a barrier. And besides the legal framework and political situations, they will already have limitations on your scope. But that initial cost is always going to be a barrier. And that's, like a snake that bites its own tail. Then we will not implement AI in those countries. We will not have enough data. So I think what we have to be doing is supporting the implementation of those projects and helping our organizations to find partners and sponsors to make that possible and break that cycle of...
Yeah, it's one of the key things that I think as we turn into 2025 and think about GAAPP, specifically in the way GAAPP supports our member organizations and all of our passionate patient advocates that are on the line with us today, is through these like innovation opportunities. So how do we dedicate funds specifically as a board? How do we ensure that there are impact funds there to support AI projects across our member organizations and across the world?
Yes.
Yeah, it's exciting times.
Yes, challenge accepted again.
Yes. So as we kind of come to the end of this discussion around AI, what are some of the current successes or ongoing AI projects or initiatives that you think our listeners should be attuned to?
So I'm going to give you 3 examples, Tonya, from our members that I think everyone is going to love. And they are so different amongst themselves. And then you will see 3 uses of AI.
This is where I love to hear from our member base, right? The people that are on the podcast today, that are listening in, like, these are your success stories. So thanks for sharing. And Victor.
Yeah, I'm sure they will blush at home. But so the first example that I'm going to give you is a project between 2 of our organizations in Spain, Sevilla Respira and Asthma Heroes, Asthma Heroes in English. Yes. So they have developed a personalized program for digital monitoring of childhood asthma. So the role of AI there is to empower caregivers, parents, and the caregiver team to provide enough information to a better monitoring those children with severe asthma, right? Okay. And so that's like a novel kind of project, and basically it's like a trial, but it has already shown so much potential, right? How can AI help support parents?
Ongoing management of childhood asthma. That's fantastic.
The second example is from someone from our board of directors. So from Migdalia Denise from Latin Health Leaders. So they have developed, with the support of GAAPP and the whole SAREA group, a project that is the Pulmonary Hypertension Multi-Stakeholder Toolkit. It's a mouthful, but it's a great project.
A little slower, Victor.
Pulmonary Hypertension Multi-Stakeholder Toolkit.
Multi-Stakeholder Toolkit. Gotcha. Okay.
So long project but the project is as big as the title. So in that project, the AI was used before. So AI actually segmented, it sectioned the content, it predicted the patient journey for those patients in advance. Obviously, then the patient goes and complete that patient journey with their own experience. But so AI was used before during the development of the project. So that is it's
to
not
sort
also
of describe what the patient journey is for someone living with pulmonary hypertension in different Latin American countries.
Yes, and predicted as well what kind of educational content the patient will need, right?
Okay.
So that was at the beginning. So that's what AI is used before, not in the front end of the project, but in the back end, in development. But that's also another use that is very important to know.
So if I understand correctly, it's basically like tailoring their patient education and, patient support to exactly where a person is in their journey, where they live, what their unmet needs are, all of that.
Exactly.
Yeah, that's really great.
And then the phase 2 of that will be the patient to complete that information, right? Because again, AI is not infallible. And at the beginning, it has the information that it has from you. But the more information you fed, the better that prediction model will be. And the better that capacity and decision-making of AI, of what content, of what support do you need, each patient needs individually and considering all the social demographics, where you live, how far are you from a healthcare center? Where are you in your patient journey? So this is a great project as well. The last project also comes from Latin America. This is the most, I think, the one that our public will be more familiar with. So they have developed a virtual doctor, an AI doctor that basically is there to answer questions and give that basic knowledge of the diseases for the patients that has difficult access to healthcare centers, right? Just because they are in rural communities or very far, or they don't have a hospital or a health care center nearby. So that virtual doctor, while they will never prescribe or they will never diagnose, obviously is just there to answer those basic questions that the patient needs to equip themselves with to be able, when they go to a healthcare center, to have a meaningful discussion and have that shared decision-making, informed decision, because they already, it's like a
And is that project any specific disease state? Is it focused on any disease state, or is it multiple disease states?
So it started with pulmonary hypertension, but then it's being scaled for all the respiratory diseases. So that's also like a novel project that is being in testing phase, but I think that's another use of AI that the public will be very familiar, because you have that physical, right, AI doctor that talks to you, like the video talks to you. So you have that person there. It's not like something imaginary. You have someone that is talking.
That's really great. I mean, again, I think that mirrors closely the asthma chat that we're launching and, are beginning to get more and more use and data from on the GAAPP site and on the Asthma Canada site. So I think by the time that we are sitting down at this table talking about this topic a year from now, we'll have so many more examples.
Yes.
So much more wealth of knowledge and information. And our augmented intelligence of good information in and good information out will be balancing more and more. And our confidence in AI will be higher. Do you agree?
Yes. And I think that's part of our job, to also increase that confidence from our organizations to start exploring how to use AI, how to implement AI in their projects. And I think that's what we have to do from GAAPP. And then we will always support our audience to do. And so just before we close, we will have downloadable with this episode, where you can actually have all of this information that we have talked today to like read at home and with those examples. So you can actually contact those organizations if you want to get involved in those projects, because always working together is always better, right, Tonya?
Together is always better. And I want to give a shout out to you because you are going to be presenting information about AI and patient advocacy at the World Patient Alliance coming up in Cape Town, South Africa, right?
Yes, very excited.
So exciting that GAAPP was recognized for our work in this space as patient advocates. You were recognized as an expert in this topic. And so I can't wait to hear how that goes and the opportunities that open even beyond the current disease areas that we're working in.
Definitely. So
any final words, Victor?
The final words that I say with advocacy and awareness, do not do it alone. Find support, join other organizations. You're not alone. You have a support network around you. Use it, and don't start a journey by yourself. Start with, start in a yacht rather than in a small boat, and then you will see how you will reach the destination faster.
Absolutely. Together is better. Great having you today. Thank you so much for being here. And thank you guys for listening in, tuning in. Please don't forget to subscribe, to share, to make sure that you're sharing this throughout your own organizations about different ways that we can be better together through the topics of the Passion for Patients podcast. Also, visit GAAPP.org and passionforpatients.com to get more of those downloadable resources that Victor spoke about. And don't forget to tune in next time, because we're going to have even greater guests talking about more innovation, novel concepts in Passion for Patients podcast. And until then, stay passionate.